He thought a career in carpentry might be in the cards. No, not woodworking, perhaps priesthood. Made sense given Dennis Murphy's deep Irish Catholic family roots. So he headed off to the seminary at the ripe young age of 14.
We dare to say, Our Father, who art in heaven.
Murphy's high school years at St. Lawrence opened his eyes to what he was taught as a kid. Give back, do something meaningful. Didn't wind up doing that as a Catholic priest. Instead, Dennis decided he'd use his compassion for people by devoting his life to keeping them healthy.
Hello, IU Health team members. I'm Dennis Murphy, the president and CEO of IU Health.
His journey from thinking maybe he'd be a carpenter or follow his Irish Catholic roots to the priesthood, to running the biggest healthcare system in Indiana. He's my guest this week on the Business and Beyond podcast. Hello and welcome to the Business and Beyond podcast presented by PNC. I'm Gary Dick. Well, how do you go from maybe I want to be a carpenter to what about serving as a priest to president and CEO of IU Health? No doubt, Dennis Murphy's life path has been unique, and I am really thrilled to have Dennis join me on the podcast this week. Dennis, thanks for joining me.
Thanks so much, Gary. It's wonderful to be with you.
Well, we've got a lot to talk about that we can talk about, and certainly about tremendous growth at IU Health and the healthcare landscape in Indiana. But as I mentioned in the introduction, your path to your role has been an interesting one, including going way back when to your younger years. You really seriously considered being a priest, right?
Yeah, I had an uncle who was a Christian brother, and somebody that I was very close to personally. And it was, I think you said, ingrained in me that you're supposed to make a difference in your life. And that was something I seriously considered. I had a really wonderful experience. I was in a Capuchin seminary, they're Franciscans, and really loved the idea of giving back, doing good in the world, being kind of spiritually centered. And it was a wonderful place to be during a very formative time in everybody's life. Your high school years are really, definitely made me who I am today.
Yeah. We'll talk about how it really came about. You mentioned an uncle, and you had a visit, as I did a little research. You visited a seminary for a weekend, and you were hooked at that point, right?
Yeah. It was that I always loved being part of a team and a bigger group, and you really felt that way when you were at the seminary, that there were a set of like-minded people all trying to do something special with themselves and their lives. A great set of priests and brothers who ran the school, who actually, it was very small. My graduating class was 28 people. So you got a lot of individual attention in terms of your own development, both academically and spiritually and personally. And so, and it was kind of interesting. My parents were both from Ireland. They left home when they were 15 and 16, respectively, to go to another country. So the idea of leaving home at 14 didn't seem like a big deal in my family. It was kind of expected. You grow up quickly and you become pretty independent quickly.
That's interesting. So family, obviously very important to you and your upbringing, as well as faith, right? Both family and faith, big roles in shaping ultimately who you are today.
Absolutely. I think anybody who comes from an immigrant family, probably your first circle is those in your family. You tend to be a little bit of an outsider. And so you cling really strongly to your family and your extended family. And so aunts and uncles and cousins are still my best friends, my closest confidants. And so it's wonderful that has a real special bond.
Yeah. Interesting too. I think another family member or their family tradition in as laborers, right? You thought seriously, I think at one point, about being a carpenter. So you must be handy, Dennis.
Yeah, I love working with my hands. Maybe unlike these jobs, there's tangible accomplishments every day. There's not a lot of committee work in carpentry. I was very lucky. I had an uncle who was a carpenter, and my father rehabbed houses and did a lot of plumbing work. And so I grew up around people in the trades and had a huge respect for kind of their hard work, their intellect. Anybody can do that kind of work is just special. So I really loved it. And it is my stress release, or one of my stress relievers right now.
Yeah. So you do projects. You do projects around the house?
Yeah, much to my wife's chagrin most of the time. But yeah, instead of hiring people, I still have my father and my uncle in my head saying, you can fix that. I'll take on some things. Since I've moved here, I've done a little bit less, but I've rehabbed 3 or 4 houses in my marriage. And it's always trying adventure with your wife if you're going to tear up your house.
Yeah, that's the ultimate test, right? You know, what's your take, Dennis, when you talk about the trades and working with your hands, and plumbers and steam fitters, and you can go on down the list, welders. There seems to be, there's such a shortage nationwide of those kind of skilled craftsmen, if you will. Do you think we as a society, and maybe we're getting back to embracing that more, but do you think we've kind of lost that touch with the laborer, those skilled tradesmen that really have helped build the country?
Yeah, I think it's interesting, Gary. If you go back maybe 10, 15 years, you and I heard a lot about the sort of information economy, and all of that. And so I really think that for a younger generation, maybe pointed people in a direction away from those kind of skilled trades that I think are critically important to every industry. I think about my own and the projects we have going on everywhere. Those kinds of people are critical to our success, and they're really talented. It is a skill and a profession, not a default because you can't do something else. I think people have a real passion and joy for that work and should be encouraged to go into it.
Yeah. Your background, your path to where you are today, a very interesting one. I mentioned the seminary. Going back to that time, what made you decide to ultimately leave the seminary, not pursue priesthood?
It probably goes back to family. Being a priest is a really tough profession. It is at times isolating and a bit lonely. And I thought about maybe the strength of my parents' marriage. My father and mother were just this amazing couple. And unfortunately, my father passed away too young, but that was a huge influence. And again, surrounded by aunts and uncles who similarly had great marriages, great families, and that desire to say, I really think that's my calling, was really important.
And you, it sounds like we're really driven by a mission to serve and to be of service. And I know you got your undergraduate degree at Notre Dame, and while you were there, you worked in what I think was Northern Indiana Children's Hospital for Disabled Children. And that, I know, you cared for autistic children while you were there, really influenced you in your life at that time.
Yeah, the acronym was NISH. At that time, a lot of Notre Dame students volunteered there. I started out as a volunteer and ultimately became one of the few students who was actually a paid staffer there. I enjoyed the work that much. And probably because I was tall, male, fairly deep voice, ended up with a group of about 8 or 9 older autistic children that I cared for because they listened. And not sure always why, but part of it was, I think, just the presence. And I also, most folks who work with me know I'm pretty calm. I didn't get flustered in that job. And just loved the connection. The kids were wonderful. The staff there were really amazing, what they gave every day, just in terms of compassion and empathy. connected with that.
Well, talk about how you steered toward this path in healthcare, your academic pursuits, Notre Dame undergrad, Duke. Talk about your academic background.
Yeah, at Notre Dame, they have a unique program. It's called pre-professional studies. So you get a arts and sciences degree, but really take all the prerequisites for med school. So I was actually a political science major, but took biology, organic chemistry, all of those med school prerequisites, but ultimately decided, I think, after some experiences working with doctors, that wasn't the pathway I wanted to choose. Kind of interestingly, wanted to be a surgeon when I started college. And the more I talked to surgeons, the really talented ones, I learned their careers are pretty narrow. The great surgeons are really good at a very focal set of procedures and activities. And probably for me, I like diversity and I like a lot of different challenges. And so I just thought I'm probably not cut out for that long term. I was very fortunate. I had a dear friend whose father was a surgeon in North Carolina. Went to visit him, and he introduced me to the hospital president at the hospital he was at, and was able to see that I could do maybe both, be involved in medicine, but not actually be a caregiver. And that was kind of the opening to say, can I pursue something different in my career?
Yeah. Well, your career path includes a number of years at Johns Hopkins, University of Chicago hospitals. You came to Indianapolis from Northwestern Memorial Healthcare in Chicago. What attracted you? And you came, I guess, about 10 years ago, 2013. What attracted you to the opportunity at IU Health?
I think, Gary, the three other places I was at, they're really private universities with just this really wonderful, deep experience related to research, education, and clinical care. But it really didn't have this broader mission to sort of care for a state or to see how you'd impact the health of a state. And that was really the attraction here, that IU Health is the only healthcare provider in the state with the state's name. And it felt like the mission was different. And that really appealed to me when I thought about where Indiana was in terms of its healthcare status, and said, if there was something to devote yourself to, what a great cause to say, can I help make a state healthier in my career? And so I've loved every minute of it. It's a great challenge, but also a great set of work to do.
About a decade at IU Health, became CEO in 2016. You have witnessed and led substantial change and growth. Talk about, for those who may not truly appreciate the magnitude of IU Health, the footprint. Talk about that footprint. You truly are a statewide healthcare system.
Yeah, so we have 16 hospitals as far north as Fort Wayne, as far south as French Lick, and in all of the major college towns, so Lafayette, Muncie, and Bloomington. We have 300 clinical locations across the state, over 35,000 employees. We're the second largest private employer in the state. And we take care of about 1 in every 3 Hoosiers in the state. And so, again, that idea that you have a footprint to really do good and really change the course of healthcare in the state, I think, is really important.
And IU Health is an academic institution too, right? That's a big part of what you do.
Yeah, pretty amazingly, I don't think a lot of people appreciate that we have the largest medical school in the country. We have one of the top 2 or 3 largest nursing schools in the country, 2 schools of public health. We just have a huge set of training that goes on here. And for us, that's sort of this great tool when you think about workforce shortages that every industry is facing now, how you work more closely with the educational institutions to train great people, give them great clinical experiences so they go out into the workforce fully prepared is just a huge part of what we do.
Yeah, I'm going to talk about a major project you have going on in downtown Indianapolis here in a minute, but back to the kind of that overall healthcare status, if you will, of Indiana. How would you assess healthcare in Indiana? And obviously, IU Health, a great example of an institution that is doing business, if you will, in urban and rural settings. So how would you assess healthcare in Indiana right now?
And if you start maybe at its highest level, Gary, our health outcomes as a state aren't great. The good news is they've gotten a little better. So I think when I got here 10 years ago, we were 44th. I think today we're 38th. I don't take any credit for that. I think that's, 100 different things driving that. But, what's interesting is 20 years ago, Indiana was 25th in the country. And
Wow.
A lot, when you look at the baseline data, it's not that we've gotten worse, it's that everybody else has gotten better faster. So whether it's fewer people smoking, better infant mortality numbers, other things like that. So I think that's the opportunity for us is how do you see real improvement? And then you've got to understand that's different in every market and every setting in the state, that how you approach those questions in a rural community is different than in an urban environment. It's different in Lafayette for us than it is in Muncie or Bloomington. And so I think understanding the assets and the people in each of those locales and being sensitive to how you come up with solutions, I think is really important.
What's the role in technology in all of this? Certainly, technology is pervasive in all sectors of the economy and walks of life. But as you look at healthcare and the ability to deliver services via technology, how important is that, and how do you see that unfolding here in Indiana?
I think it's critical, Gary, maybe on two dimensions. One is access. So I think technology allows for people in rural communities to have access in a way that they'd have to get in a car and drive, some upwards of an hour plus to get access. The other really interesting thing, I think, on the access dimension is frequency. It used to be you'd go see your doctor and they'd say, come back in 90 days and see me again. Now I think with technology, you can say, how about I give you a phone call? How about a telemedicine visit? In 2 weeks, it may be as short as 5-10 minutes, but that frequency of interaction, I think, will lead to better health as well. Then the other big dimension on the technology standpoint, I think, is the cost of healthcare issue, that if you're able to do more things remotely or via telemedicine, like you and I are talking today, you don't have all the capital infrastructure to do that. You can actually reduce people's readmissions and other utilization issues that I think just were barriers before. So I'm really excited for the future of healthcare because I think we're just scratching the surface on how to use it.
What are your biggest concerns as you look at access to healthcare? I mentioned rural communities and the access that folks in lesser populated areas have, and for that matter, in urban communities as well. What are the big barriers you see, or the big concerns you have?
I think, Gilly, we're fortunate that, we're one of the states that expanded Medicaid. So in some places, just insurance coverage is a barrier. I think for us in Indiana, it's helping people understand they can get insurance coverage, because that becomes a barrier if they don't know they can get coverage. Transportation. And again, you said urban and rural. I think maybe for me, the underlying issue may be more poverty than geography, that your income status may dictate some of that. And then, I think it's also supply. Do we have enough primary care physicians? Do we have enough behavioral health workers? Just the aging of the population is putting a lot of demands on the supply side. And I think we just have to make sure we're well equipped as a state to provide care for everybody who lives here.
Well, growth continues at IU Health, a $4 billion plus hospital and expanded campus that is coming to life as we speak on the near north side of Indianapolis. We'll talk about that and more when the Business and Beyond podcast returns.
At PNC Bank, we're committed to making a difference in the lives of our customers and communities by helping them move forward financially. As a Main Street bank, we try to do right by our customers with every encounter. Our local teams offer personalized financial advice to help guide you in making the best decision. We're proud to be part of your community. PNC Bank. See how we can make a difference for you at pnc.com. Copyright 2022, the PNC Financial Services Group, Inc., all rights reserved.
Welcome back to the Business and Beyond podcast presented by PNC. My guest this week, a very busy guy, Dennis Murphy, the CEO at IU Health. And Dennis, as we talked about growth and the ever-changing landscape in healthcare, IU Health is in the midst of a really massive project that is really going up pretty quickly because we pass it a lot. $4 billion plus, a hospital, expanded campus, a teaching academic center, all together around the, I guess it'd be around 16th and Capitol in that area of Indianapolis. Talk about, Dennis, the project, and first of all, the scope and what all is involved.
You know, this, Gary, is fundamentally a replacement project for University Hospital and Methodist Hospital. And there are parts of Methodist that are over 100 years old that we still use today. And we came to this critical juncture of we either had to invest a lot in both or create something new. And just when you did the math, it made more sense to build one replacement facility rather than continue to invest a lot of money into older plants. This is actually one of the largest healthcare projects in North America. So not just the United States. This is a huge undertaking for us. But as you said, critically important because I think this is not a single function facility. I really think the facility is secondary to what we do inside the four walls. We are, for many services, the state's provider, whether that's transplantation, bone marrow transplants. We do 50% more trauma than the other level 1 trauma centers put together. And so also during COVID, we saw that we have to be a resource, not just for other IU Health hospitals, but for hospitals around the state. And so making sure we have that capacity and capability in this building will be really important.
As you look at the location in that 16th and Capitol area around the old Methodist Hospital that folks are familiar with, but if you kind of broaden out the scope or broaden out the view, if you will, the access and connectivity to the IU School of Medicine, IUPUI, all of those assets, does that set up something that's even much bigger, in terms of a healthcare corridor and a grouping of healthcare assets?
We've looked at this, Gary, from the beginning, that if all we built was a really great hospital, we would have failed. That this is really how do you create an improved environment and neighborhood, something we're calling the health district. And as you said, whether it's 16 Tech, whether it's IU and Purdue on their new campuses, but I think importantly, even with other partners in our neighborhood, like the Children's Museum, Citizens Energy, others, I think all of us have this common goal of seeing this project being part of a broader effort to improve the health and the neighborhood that surrounds us, and that there's kind of this equitable growth that I think is, was initially fueled by the Red Line and real transit-oriented growth that we'd like to actually help accelerate as well. So I just look at this as a huge opportunity for this northwest component of downtown to really change and grow over the next couple of years.
In your view, can this, as you look at the bigger picture, and you mentioned IU and Purdue and the new Indianapolis campus and how that's going to take shape, and Purdue, their new president Mung Chiang, talking about a 63-mile corridor between downtown Indianapolis, the what is now the IUPUI campus, and West Lafayette, the investment by IU Health and all the other things. Can this be kind of a transformational time over time for Indianapolis, but also, more broadly, Central Indiana?
Absolutely, Gary. I've been fortunate to have worked at some pretty amazing places in my career, and this is one of them. And I think that combination of assets of really high-end engineering, a phenomenal medical school, a whole set of basic science departments that really don't get talked about a lot. Within IU, there's an unbelievable chemistry group there, and then you have the sort of practical application of that in clinical environments. You have great corporate entities like Cook, Lilly, all of the orthopedics manufacturers up in Warsaw that are looking to work with us down here. I think we have elements that rival better known biotech centers like Boston and others that we can actually develop. I was down in Raleigh-Durham early in my career. That research park there was not nearly as big back then as it is now. So I do think that is, our potential, just given the core assets we're starting with.
Yeah. As you look at talent, and certainly IU Health, you have a distinct need to keep and attract talent. But more broadly, Indiana is one of the big issues. Perhaps, you could argue is the big issue for the state is that whole talent equation. Do you view IU Health, your investment and the investment of others, as being kind of a key part of that talent attraction equation?
100%. I think we as Hoosiers tend to be a little modest. And I always compare recruiting to East Baltimore, which is nowhere near as attractive a location or a city as what we have here in Indianapolis. We should be proud that there's not only a great set of corporate assets, but there's a great community, whether it's the entertainment industry, sports, restaurants, other things. Great schools. I really think we have to frame ourselves as the best possible place for people to be in the country, to come work, but also to live. And we see that as we recruit people from around the country and around the world to be our clinical leaders, to be part of our corporate team. We should be proud of who we are. I don't think we tout ourselves the way we should. It's a great spot to recruit to. I've actually not found it to be a disadvantage. It's actually been a positive.
Okay, Dennis, what's next on your plate? You've got this big, massive project going on that takes up, I'm sure, a lot of your time, as well as a number of other things on a statewide basis. But as you look out the next, 5 years plus at IU Health, what did you see as the big opportunities, challenges, opportunities going forward?
Gary, we always talk about how do you make Indiana a healthier place is kind of this very focal vision for our organization. And so part of that is when you need care, how are we going to be the destination and provide the absolute best care? I think this cost of healthcare and the value of healthcare is really important. And we consider that kind of population health. How do you ensure you have all the best outcomes for people in that population? So best healthcare status, best healthcare outcomes, lowest cost, highest patient satisfaction. And then I think new in our industry, probably over the last 5 to 7 years, is really how you think about social impediments to health, being engaged in things like education, safety, food access. And I think you'll see IU Health continuing in those 3 domains externally, all focused on that goal of let's make Indiana a healthier place. But, it's going to take success in all of those domains to make that happen.
Dennis Murphy, the CEO at IU Health. Dennis, it's been a real treat to catch up with you and learn a lot about you that I didn't know, including that situation with the priesthood, carpentry, although if I have another project at home, I might give you a call and come over and help out on that.
If there's a leaky pipe, that's my specialty, Jerry. I can handle those.
Outstanding. Well, Dennis, thanks again, and thanks for your leadership in our community as well. Dennis Murphy, the CEO at IU Health, our latest edition on the Business and Beyond podcast. And I want to thank you for joining us this week on the podcast. This is a weekly discussion with achievers in business, sports, entertainment, and beyond, all brought to you by PNC as well. I'm Gary Dick. You can catch all of our episodes and get Indiana business news 24/7. All you have to do is go to InsideIndianaBusiness.com. I'm Gary Dick. Thanks for joining us. We'll see you next time.